News 8's Jessica Leffler spoke with two people on both sides of the aisle, and she's live along the medical mile with what they had to say. Jess?
Brian, Sue, here on the medical mile, discussions about health insurance happen almost every day. There are a lot of questions about this 5,000-page document, and people on both sides of the coin, some who simply want to keep their insurance and others who just want coverage.
I did just have knee replacement surgery, and my experience was very good.
Jeannie Engelhardt, the president of the Grand Rapids Chamber of Commerce, says her insurance is great and just covered a major knee surgery.
But I'm one of the fortunate few. I have coverage through my employer, plus my husband has coverage through his retirement. So, you know, my situation is not typical of many people.
We tried all different.
Not everybody is in the same boat.
Without appealing and writing your story to different people, which can be exhausting at times too, you really don't know what's out there for help.
Pamela Erdmans isn't as lucky. The once stay-at-home mom is now working part-time following a divorce and is without insurance. She contacted 24-Hour News 8 with questions for DHS when her Medicaid coverage was canceled in August 2009 and says debilitating hip pain has made it difficult to function.
Because I used to be a runner and I was always very active, worked out, and he said I have osteoarthritis, which just means arthritis in the joint.
Following a visit to the doctor and physical therapy that hasn't quite fixed the problem.
If I go really slow, my hip doesn't hurt so bad.
She has a difficult time paying for the $151 deductible.
Which, you know, being a single parent now and just working part-time and depending on just child support and some support which doesn't really come, it's hard. It's hard to come up with that extra money.
She was able to pay her medical bills with the help of a benevolent fund through the Osteopathic Associates and is still trying to figure out how to pay her other medical bills. Pamela investigated paying for insurance for her family, but says that's not an option.
I'm kind of at the mercy of help and our system.
Pamela's children have insurance coverage through Medicaid. Coming up at 6 o'clock, we're going to delve into the issue of small businesses and how the Chamber of Commerce here in Grand Rapids is having trouble answering their questions. For now, we're live in Grand Rapids. I'm Jessica Leffler, 24-Hour News 8. Back to you.